Hello everybody, Andrea Twarowski here with Dentalelle Tutoring. So I had the most excellent, question the other day, and I don't know why I didn't think about this before, but somebody was asking for some resume help, which makes perfect sense. I remember when I was a student, I was lucky actually because we had a full class on how to write a resume when I was in dental assisting. And I was lucky enough to keep all of those notes because it did help me so much. Because if you've never had to write one before, or even if you have, the resume that you wrote when you were 16 will look completely different than the one that you are going to write to be a dental assistant or a dental hygienist, right? It will look a lot more professional. You may be wondering, sorry, I thought I heard a noise from my puppy. I think she's just playing under the bed. I hope she's not stuck. Just kind of looking at my puppy here for a second. Hope she's not stuck because she's not making any noise. Nope, she's fine. Sorry, I checked. I don't even know how she got under the bed. She's tiny, but she's not that tiny. Anyways, you guys, I'm sorry. Where was I? Shoot. So we were talking about resumes. I was talking about how I took a class when I was a dental assistant. Oh, yes. So, you know, it can be a very overwhelming thing because honestly, if the resume is too long, the office won't even look at it. If the resume is too short, the office won't even look at it. I can't tell you how many horrible resumes I have seen. And these are from people who want to work as a dental hygienist and a dental assistant. So I don't understand why the resumes look so bad. And I'm not saying this because I just don't like the way they look or the way they sound, but there's spelling mistakes in them. Or they'll put their high school, info first, and then they'll put their college info second. And that's just a common no-no, at least what I thought, right? But I guess it's not. So I would like to talk to you guys about, first I'll talk to you guys about how to write a resume in general. Sorry if you hear that. You can actually see them. My two dogs are playing right now. I apologize. But I'm going to talk to you guys specifically, I think, how to write the resume for if you're, you know, new out of school, because you are probably thinking, well, an office won't want to hire me because I don't have experience. But you know what? You have to have experience somehow, right? You know, you can't work somewhere, you know, like you have to have experience somehow. And how do you get experience? You get experience by working. So it is all about how you write the resume, okay? Because if you say, hypothetically, you put in the resume, I don't have enough experience, I'm sorry, which no one would ever say that. But if you did, the office isn't going to hire you because you don't sound very confident. So it's about sounding confident. And I should do another video as well, how to rock your interview, because you can have the most amazing resume ever, but if you don't sound confident in the interview, they're not going to hire you. So, and I can speak from experience. I have worked in a dental office now, or I've been in the dental profession for about 13 years. I have sat in while they are hiring a new dental hygienist and a new dental assistant, and I can almost tell right away who will be good in the interview and who will be horrible. But again, I'll save that for another video because I can talk about that forever. But I have also seen some horrible resumes, and I've seen some amazing ones. And I also speak from experience because I left my dental office of 13 years last year because I am now tutoring full-time from home. But I have become a temp hygienist also because I still wanted to remain current, you know, so I became a temp hygienist. And some offices, they simply allow you to come on the spot. But then there are other offices who said, do you mind coming in for the interview first, because we would like you for, you know, a week or two. So I'm like, okay. So then I had to be like, oh my God, it's been like 13 years since I had an interview. What do I wear? I have to write a resume again, you know, so I had to go through all of that too. And, you know, I learned a couple things along the way. So anyway, so I am actually going to show you guys my most recent resume. So let me share my screen. I'll show you guys that. Now I'm on my laptop and I'm not normally. So I'll show you guys the resume and then I'll show you guys my cover letter. So let me show you guys the resume. Can everybody see this resume? Okay. So as you can see, it's not on just, plain, paper. It looks a little bit nicer. And I think I found this in Microsoft Word. So all I think I probably did a search for resume templates within Word. I'm pretty sure I did this about a year ago, so I don't remember, but it was probably that. Look for a nice clean professional template, but this will set me apart from somebody else because offices probably get a lot of resumes, so you have to somehow set yourself apart. So as you can see in the template here, my name is pretty large at the top. I put in my number, my email, and that is something you should always have, because let's just say they lose the second part. You should have your name, your number, and your email on every single piece of paper. You don't have to have your email if you don't want to, but I just like to include that in case that's just easier for them. So you should always have an objective. So whether you're looking for a job as a dental assistant or as a dental hygienist, if you want full-time or part-time, be specific, because, there are some dental hygienists out there who are also a dental assistant, and they have said to me, well, I put on my resume that I am looking for full-time dental hygiene, but I would be okay to do dental assisting too. But I do not think that's a good idea, because you have worked so hard to do dental hygiene. So why would you set yourself short and say, okay, well, I'm okay to make less money if that works for your office? There's nothing wrong with, being doing your dental hygiene duties and then saying, but I do have skills as a dental assistant too. So if you ever needed me to help you with that, like if I have an opening or something, then I am more than happy to help. But I don't think it's a good idea to say, as an example, I'm seeking a full-time dental hygiene position or a dental assisting position. I think you should pick one or the other. If you have skills as a dental hygienist, it just makes sense to want to do that. Like I became a restorative hygienist a couple years ago. And, it's a lot harder for me to find full-time work as that. So that's why I put in hygiene and restorative hygiene, only because I know that will help offices look at my resume a little bit more, because in my experience, if I only put down the first part, that I'm seeking part-time as a restorative dental hygienist, some of them, say, well, we don't even know what that is, so we're not interested. We don't even know. We don't want you to do that. But they may be looking for a hygienist to, say, work on Monday afternoons. That is okay, because that's all that I want. Like, I don't want full-time. I don't even want part-time. Like, I'm okay to work a Monday or a Thursday, here or there. So that's why I put that in there. And then, the rest is up to you. You could say, you do not have to lay out your resume exactly like this, but this is just how, I decided to. I even did a search online, and I just typed in examples of dental hygiene resume, examples of dental assisting resume, and then I just sort of looked at things that I liked on theirs and then thought, okay, well, I don't like that part, so I will change that to make it sound more like me. Oh, this part I like, I wouldn't even have thought about that, so I will add that in. So then that's just kind of how I did mine. So yours obviously doesn't have to look exactly like mine, but I just sort of wanted to give you guys an idea. So at the top, I like to sort of just add a couple things, because obviously they can see, like, oh, she can cement a temporary crown or bridge, so she's more than just a dental hygienist. She's a restorative hygienist. So even if we have her working as hygiene, well, she could help us out doing that too. So I'm more of an asset to an office because of that. So that's just kind of why I did add that. And I do find that a lot of offices ask if you have experience taking x-rays. I don't know why, but they do ask. So that's why I did add that in here, especially for a student or somebody who was done school maybe a month earlier. They will ask you, how are your x-rays? Because you have to take excellent x-rays, but they also understand that you're new, so they don't expect you to take perfect x-rays every time. But to answer their question, say, yes, I can take x-rays. You know, you don't even have to say, well, yes, I take good x-rays. Some of my x-rays are bad, but I'm willing to learn. You know, you don't even have to say that because that's to be expected. I think you should all say, yes, I take excellent x-rays. Even if you do not, then take that time to learn, okay? Ask the dental assistant in the office, you know, to help you or whatever, right? So that's just why I put that in there. And then my next one, highlights. So think of, you know, you as a person and be honest, you know. People tell me all the time, you know, like, in fact, I saw a patient just the other day, I think on Monday, and she just kind of said to me like, oh, wow, well, you are probably the nicest person that I've ever seen here because you took the time to answer all of my questions, and that's never happened before. You know, you are so knowledgeable on, it seems like, everything. So like, thank you for taking the time. And I've heard people also say like, oh, wow, like you are so nice, you know, that hasn't ever happened to me before. Like usually I get yelled at, but thank you for being so nice. So think of things that people have said to you in the past. So that's just why I did add that here. And can everybody see that? Maybe I should make that larger. I don't even know if I can make it larger. Oh, yes, I can. I'm not normally on my laptop actually. So, okay, can everybody still see my screen okay? So sorry that was a bit smaller before. I hope that everybody can see it now. And if you would like to actually see this, because if it's too small for you, feel free to send me an email and then I would be happy to show you. Okay, so what was I saying? So yeah, so pick apart things that are more, you know, personal to you. So that's why I did add that I am complimented for my friendly and pleasing personality, knowledge, and professional work ethic. So that sounds a lot more professional than if I said, patients think I'm nice, I like to work with patients, and I show up on time. So all of that means the same thing, but this sounds a lot more professional. And then the second line is a strong work ethic, reliable, and flexible. That is excellent, I think, because, you know, I could have said, I will show up on time, I will always show up when I'm supposed to be there, I will not be late. If you need me short notice, that is okay. So that all means the same thing, but obviously sounds a lot more professional. So, you know, think of things that any office would want. They want somebody who does not call in sick all the time, you know, but you don't want to put in your resume, I am never sick, because that doesn't sound professional. So think of another way to make it sound professional, such as, you know, you are reliable and you have a strong work ethic, because that sounds nice and that sounds professional. The rest of them is just sort of something that I did add in there. Since I've been a tutor for a long time, I did add that in there too, that I do have the coaching experience. I'd like to talk about oral health, so I did talk about that too, or I did add that in there, I should say. So, you know, just pick some things that will make you stand out. And that's why I put it towards the top, because some offices, they might look up to here and then say, okay, this sounds horrible, we're not interested, and then they don't even look at the rest of it. So make the first part sound amazing. And then for your work experience, so I just added my more recent work experience. I've been at the same office though. At the time, I was pretty much at the same office for a long time as a dental assistant, but I didn't even add that I was a dental assistant because I've been a hygienist for so long that I don't want them to necessarily know off the bat that I do have the dental assisting knowledge, because then they could be thinking, oh, well, we need an assistant once a week and a hygienist twice a week. So would you be interested? I'd say no, okay? I'm not interested in doing assisting. That's why I went to school, was to be a hygienist. You don't actually say that, but that's just why I didn't put assisting in here, in case some of you were thinking, well, why didn't you put assisting in here? Because you don't want to make your resume too long either. So put in your more recent experience. Now, for those of you who may not have any dental experience, you might be wondering, well, how do I write my resume? So hopefully, but even if you didn't, that's okay. But hopefully you did have a job as a teenager. Okay, so put that in there. I wouldn't put that in there first. I'd say the first one that you would put in there is your clinical experience. So that's what I did when I was a student. My headline would be something like my clinical experience as a dental hygienist, Toronto College of Dental Hygiene. I would put the date of my entire program, so when I started and when I finished. And then I would put in here, you know, how many hours of clinic I had, how many patients I saw. I would put in there, I saw patients of advanced perio condition. I would put in there oral hygiene education, because you have to do a lot of that, obviously, as a student. I would put in there digital x-rays, you know, things along those lines. So does that make sense so far? Because you do have experience, not real world experience, but you have clinical experience. And then the next one, as I said, hopefully you have experience from a teenager, put that in there. And then I would put your, if you have any other experience. So it depends on the types of experiences you have. Let me know if you have any questions about that. But like I said, first and foremost, I would put in your clinical experience and then your more recent work experience prior to that. So if you were in high school, if you had a job while you were in college, you know, things like that. And then the next one, additional experience. So not everybody will put something in here. So if you don't have any additional experience, then you wouldn't put this in here. But additional experience would be something like if you did any community service, that is additional experience. If you do something on the side, like I tutor, so that's why I put that in there, but it depends on what you do on the side. Like if you clean houses on the side, I don't know if I would put that in there necessarily, because that has nothing to do with hygiene or assisting. But if you tutor, let's just say on the side, then I would put that in there. If you're, I don't know, I can't think of anything else. So you might not have anything for additional experience, but it's a good thing to put in there if you do. And then of course your licenses, put them all in there, because offices want to know. They might ask you, are you a part of the CDHA or the ODHA or the CDA, or, you know, whatever, right? For dental assisting, they will want to know that you are a part of the association. And that should be obvious, but they will still ask you. And then of course the education. So as you can see, I did not put my high school in there only because I have a lot of, you know, I have a lot of other things to put in there. You would put your high school in there. I don't think you need to add your public school, because they obviously know you had to go to another school to attend high school. So I would not put that in there, but I would put your high school. Unless you were a dental assistant before and you took other programs in college, then you don't need to add your high school necessarily, but put all of your things here. So like if you took, I think I said health sciences here because I took that first before I became a dental assistant, and then I'm dental assisting, and then so on and so forth. So always put in your education. Now, if you can help it, your resume should be 1 page only. Mine, for some reason, is 2 pages, but I could have sworn, oh no, I'm sorry, it's 3 pages. If you can do the 1 page, that's always preferred. And if you don't have experience, you might be able to. Or 2 pages at the most. I don't know why mine is showing 3 pages. I could have sworn that I did sort of move everything onto 2 pages, but it should be 1 or 2 pages at the most. At the most. If it's more than that, they will not look at it, or if they look at it, they will be thinking, wow, she's just putting her life story in here. This is just weird. I'm just being honest. That is what we think. I have seen a resume before that was 5 pages. It was awful. And I don't know how else to say this, but we didn't even look at it because we thought, okay, you know what? The resume is 5 pages. She is literally listing everything that she has ever done in her life. And that also shows that perhaps she hasn't been able to hold down steady employment because she worked in a lot of different places. And in the cover letter, she didn't explain anything about those other places. So we were kind of like, you know, I'm not really sure. So, but anyways, more about the cover letter after this. And you should also include the references. You do not have to include them with the resume if you don't want. You could simply say that it is available if they want to see it. That is up to you. There's no right answer. There's no wrong answer. And I just happened to put my resume online because that's just something that I like to do. You do not have to, okay? You do not have to put your resume online. But yeah, you guys, so either 1 pages or 2 pages at the very, very most. Mine, for some reason, is 3 pages, but that was a mistake. I do have to make that shorter. Okay, so did I attach my cover letter? I might not have. Oh, sorry. I stopped sharing my screen here. Let me just double check. Maybe I didn't attach my cover letter. I thought I did. I think I attached 2 resumes by mistake. Yeah, I think I did. So you know what, you guys? I'll talk about the cover letter in the next video. How's that? Because I actually just don't have it with me. But what I can say, though, is in the cover letter, it should be 1 page only, obviously. It shouldn't be more than that. And the cover letter is meant to make you sound amazing, plain and simple. So the first paragraph, which again, I should show you an example. So all I'll say for now is that the first paragraph, you're pretty much listing the type of job you are looking for. The second paragraph is you, I guess, telling a little story about yourself in a very short form. Like if you were a student, or I'm sorry, if you were a student, you would say something like, I should think about this first because I want to give you guys some good material. You would say something like, you know what, let me think about that, okay? I will stop the video now. I will pull up the cover letter that I have, and then I will show you guys in the next one. So I'm going to stop this for now, and I'll talk about the cover letter. But if you guys have any questions about writing the resume, let me know. If you need help with it, let me know, because I am happy to help. If you are a student of Dentalelle, or if you are a Dentalelle member, I will look at it, not a problem. If you are not, there is a small charge for that. I will double check the price. I can't remember off the top of my head, but it is worth it because you want an amazing resume. And I was in charge of looking at them for the longest time, and I know what offices want and what they don't want, so I can help you. But yeah, so I do hope this helped. If you guys need anything, of course, let me know. I will double check the price if you'd like. If you would like me to help you and to look over the resume that you have, I am more than happy to help. So I will see you guys in the next video. I'm going to upload this now so everybody can see it. And I hope this helped. Talk to you soon.